Did you know that a pregnancy can occur outside the womb? Imagine a fertilized egg growing in a place it shouldn't be. Today, we are diving into the mysteries of ectopic pregnancies. An ectopic pregnancy happens when the fertilized egg attaches in a place other than the uterus, like the fallopian tube, ovary, or abdominal cavity. It can also occur if the egg attaches in an unusual spot inside the uterus, such as the cornea or cervix. It's rare, but sometimes pregnancies can happen in both the fallopian tube and the uterus at the same time, known as heterotopic pregnancies. The chance of having an ectopic pregnancy goes up as a woman gets older, has more sexual partners, uses an intrauterine device, or has had pelvic inflammatory diseases like gonorrhea or chlamydia, or pelvic surgery. If someone has had a miscarriage before or has damage to their fallopian tubes, the risk of it happening again is about 10%. An ectopic pregnancy happens when factors, either mechanical or functional, prevent the fertilized egg from reaching the uterus. One main cause is believed to be a mild infection, with about half of women who have surgery for ectopic pregnancy showing signs of chronic pelvic inflammatory diseases. If the fertilized egg implants in a part of the fallopian tube that allows for attachment, it can lead to a process similar to a normal pregnancy. However, the tube's limited flexibility may result in rupture. This rupture often causes the death of the fetus, but in rare cases, the fetus may still be viable, leading to a secondary abdominal pregnancy. In an ectopic pregnancy, the lining of the uterus reacts to pregnancy hormones, but if the ectopic pregnancy ends, the uterine lining may shed as a cast or fragments mixed with blood clots. During a checkup, it's important to measure pulse rate and blood pressure. Some signs of ectopic pregnancy include shoulder pain, low blood pressure, fainting, dizziness, and a fast heart rate, which are more common if the ectopic pregnancy has caused internal bleeding due to a ruptured tube. When examining the reproductive organs, should be done cautiously as it might cause a ruptured tube. Procedures like laparoscopy look inside the abdomen, and uterine curettage, which is scraping the uterus, have been commonly used to diagnose ectopic pregnancy, but they might not always confirm it. Another test called kuldocentesis, used to check for internal bleeding, is not helpful in detecting early ectopic pregnancies because it's based on later stages of the condition. Using blood hormones levels, which are HCG, and specialized ultrasound, which is transvaginal sonography, helps in checking for ectopic pregnancies without invasive procedures. Doctors look at both HCG levels and ultrasound images together. They use a specific HCG level to determine if an embryo should be visible inside the uterus. If there is no embryo seen in the uterus, it could mean the pregnancy is not in the right place. Finding a sac with an embryo or leftover embryo parts outside the uterus on the ultrasound is a clear sign of ectopic pregnancy. Sometimes the ultrasound might show an empty sac or a mass that looks different. Fluid in a specific area is a sign that could indicate ectopic pregnancy, but it's not definitive. In a small percentage of cases, a misleading sac-like structure might appear in the uterus. If a woman has high HCG levels but no embryo seen inside the uterus on ultrasound, the doctor might suggest laparoscopy to confirm an ectopic pregnancy. Ectopic pregnancies have traditionally been treated with surgery, either through open surgery or using small incisions. Now, with more ultrasound use, doctors can detect ectopic pregnancies earlier, sometimes even before symptoms show up. Besides surgery, there are newer non-surgical methods like draining the ectopic sac, injecting certain substances, or using medications like methotrexate. These non-surgical options can be better because they avoid surgery and the use of potentially harmful drugs. As we diagnose ectopic pregnancies earlier, it's become clear that some of them can resolve on their own without any treatment. So doctors sometimes choose to watch and wait without doing anything, assuming the body might resolve the issue naturally. However, not everyone can be treated this way, and strict rules are followed to choose who might benefit from this approach. Regular ultrasounds and hormones levels checks are crucial to monitor progress for those under observation or treated with surgery. And that's a wrap. I hope you found this information valuable. Remember to subscribe for more informative content, and I'll see you in the next video. Stay informed and stay healthy.